As we have seen in the further earlier video, third cranial nerve comes from here. This is third cranial nerve nucleus and this is Edinger-Westphal nucleus and this is red nucleus. From here the third cranial nerve originates and travels laterally to the red nucleus and comes like this. And for further pathway we have to know the other relations of our brain anatomy. Suppose this is our cerebrum and here is our midbrain, this is pons, this is medulla and this is our spinal cord, and here is the posterior side. From here there will be fourth ventricle and this is our cerebrum. Okay, and third cranial nerve, and this is superior colliculus, this is inferior colliculus. So third cranial nerve comes from here, travels ventrally, and along with it the Edinger-Westphal fibers also comes, which are general visceral efferent fibers, and these are general somatic efferent. These provide somatomotor fibers and these provide the parasympathetic fibers. And for further anatomy we have to know the blood supply also. This is our midbrain. Okay, and this is midbrain. Sorry, this is midbrain, pons, medulla, spinal cord. From here what happens is these are two vertebral arteries which forms the basilar artery, and here the vertebral arteries gives pica, which is posterior inferior cerebellar artery, and from here the ica comes, that is anterior inferior cerebellar artery. Then the pontine branches come and here there is superior cerebellar artery, and then it gives posterior cerebral artery, and then the further supply is from the internal carotid artery, which gives rise to medial cerebral artery and anterior cerebral artery, and then the circle of Willis is formed. Here what we have to know is when the third cranial nerve comes out of the midbrain, it travels below the posterior cerebral artery and above the superior cerebellar artery, that is its course travels like this. So when there is vasculitis or aneurysm of posterior cerebral artery and superior cerebellar artery, it compresses the third cranial nerve and hence the third cranial nerve palsy happens. This is the clinical correlation what we have to know from this anatomy. And